Do you think the vaccine is an empire? Hey.
No.
In a pandemic, a vaccine isn't only a medical product, it's actually a map of power. Who get to decide, who get protected first. And remember COVID-19?
In this section, I argue that COVID-19 vaccines function as an empirical proof of what we can call the pharmaceutical empire, not because vaccines are uniquely controversial, but because the pandemic made the pharmaceutical power unusually visible, fast, concentrated, and difficult to deny. Intellectual property functions as the legal gate, defining who is permitted to manufacture, who can enter the market, and under what terms.
You can see that with the IP, everyone is happy and pleased to welcome us. And with the IP, everything is accessible. That is the power of IP or intellectual property, the thing that you never know.
So the vaccine empire, which is the IP empire, will serve as our today case study for 4 reasons.
So the first one is the vaccine empire is operate during the crisis and the mass vulnerability when the society are most exposed and most desperate for the solution, and this is when the vaccines empire become visible to us.
So you can see that different from the normal medicine, which is for the daily disease treatment, vaccines is on the prevention scale, it's on the other spectrum. So when we're talking about vaccine, we're talking about the collective risk management of the whole society that can prevent. So that is why when people first thought of vaccine, they thought of, are you toying with God?
And the third reason is during the pandemic, the vaccines is shifted from a biomedical tool to the instrument of the emergency governance, where it can allocate the regulation, can become the prioritization, become the supply chain, and most importantly, it can become the passport to access the healthcare system. And do you think this is a normal patient?
Oh no, I'm actually the vaccine specialist. So we've been talking about vaccine, and during COVID-19 vaccine, it has become a central hub of power. That is where the vaccine is more concentrated, accelerated, and mostly visible to everyone. Everyone needs vaccine, and they gotta use vaccine to get help. So that is when it comes to very critical questions. It's not about good or bad, but vaccine empire, like the way we frame it, the IP empire, is about knowledge, and knowledge in a way it is power. So knowledge with this sense of power is like what Michel Foucault has mentioned, that they abuse the knowledge. Who preserve the knowledge, who has the right to get access to the knowledge, has the most power in the vaccine empire. Okay.
Okay, so a lot of arguments indicate that the waiver would make the pharmaceutical company less willing to respond to the next crisis because of the undermined innovation. However, in rebuttal, a lot of people accuse that the development of the vaccines were publicly funded, so it presents really little or no risk for the pharmaceutical company, and the vaccine development costs that not covered by the public will be recouped many times over the profit. And besides that, countries also argue that the waiver is bad because it can make their patent and their copyright be used from another countries that have the poor relations to them.
And that is when we have the vaccine nationalism. Okay, so now we've been talking about vaccine empire, and we see how important this little thing is. But the point is that vaccines are also about IP, and IP is about protections of innovators. So we have a thing called the STRIP agreement. So STRIP agreement is the agreement on the protections of patents, of IP, of innovators, and also undisclosed information. So there are countries, the wealthier countries in the history, has tried to oppose the waiver, while the poor one trying to strive for the IP.
Why is that? It's simply because when we look at the case of EU, of US, or Switzerland, we can see that they are home to one of the largest pharmaceutical companies in the world, and thus they have the most vaccines availability compared to poorer countries. So now we see that while these richer countries trying to oppose the waiver, they're trying to block it. So the IP, it doesn't function as only the protectors of the people, but also they are kind of like provide a hindrance to people getting access to these vaccines. Remember, there was a lecture on Jeff Bezos with the tech empire, and we talk about how Amazon has capitalized on data control and getting as much data as possible from every daily activities from other people. And this data control serving as knowledge control also manifested through the IP, where the patents are the knowledge withholding tools for pharmaceutical industry. And when we see that there is a very similarity, which I would say that for Jeff, he kind of used data as his empire fortress, not through the warehouses, by capturing every click, purchase, and search. However, IP, on the other hand, serve as this knowledge withholding, that they try to create this fortress to keep it secret, to keep it like a private access, while Jeff, he has already maximize whatever knowledge that he has to the market, and the market can respond to what he's put out there. So basically it's like it's very open, and in a way it's very public. But compared to that, we can see that the IP is a very secretive weapon that people wouldn't want it to be publicly exposed. And remember the TRIPS agreement, where we have the international patent laws that the wealthy country trying to oppose the waiver. And lastly, is the most critical thing is dependency. Especially during COVID, people need vaccine to save themselves, so they create a mass dependency on the vaccines. And that is when people have to either like wait for donations or pay higher price, like very high price, just because they legally bear from using that knowledge to save themselves. This is so the core idea is that both empires like rely on intellectual monopolies, but for Jeff is using the algorithm to push out there to like go on a mass level, but IP is on preserving and trying to keep it as secretive as possible.
This is not just about IP,
but this is also about money and profit.
We uncover the pharmaceutical empire is a modern colossus. This empire's power is exercised not through force, but through medical authority, definition, and treatment promises. Pills replace weapons and cures replace coercions, manipulating population through the threat of disease. So, the grand question here is, what qualifies this system as an empire? And the short answer is the two pillars that pharmaceuticals stand on. First, the drive for profit, and second, tight control over IP. Pharmaceutical power is not abstract. It's built into legal and institutional architectures that organize who may live, who must wait, and who must pay.
Public health is meant to serve the public, but this mission has been subverted. For example, in 2024 alone, farmers' lobbying has reached more than $390 million, showing that these policies have been twisted into profit pipelines. And this is echoing imperial orders, where the societies will be bent to the elite will.
Now let's dive into details. Pharma extract millions by monopolizing drugs often seeded with public funds. Consider Pfizer's COVID-19 vaccine. While publicly funded science enabled rapid development, IP regime erected legal barriers that blocked affordable generics across much of the global south. These patent laws function as invisible walls, legal space that structure access long before a patient ever reaches a clinic.
Now, let's go into the heart of it. Money and IP. The system is built based on patents, and the long-term drugs monopolies aren't just about rewarding innovation, but it's also a legal tool to decide who can make medicine or who has to wait or paid, turning life-saving treatment into controlled assets.
Take AbbVie Humira as an example. By layering over 100 patent seekers blocked generic, the company kept cheaper generics out for years, earning roughly $200 billion in revenue, while US patients had to pay more each year. The COVID-19 vaccines made this blueprint visible. Pfizer and Moderna held tightly onto their IP, refusing broad technology transfer to fewer countries. Access followed power, not need. Much like all empires that control trade routes for the benefit of elites, the system does more than generate profit. It shapes who gets treated and who waits, aligning global drug priorities through institutions like the WHO in ways that, in practice, often reinforce the dominance of patented medicines.
They drain your money away for profit and stuff. Even when if you account for economic factors, it shouldn't be this.
From our team's reading, Pharma is stayed as a protective guardian, yet the evidence shows how disease awareness campaign can mobilize fear and expand reliance on drug solutions, alongside global regime that standardize health priorities and practices. Amid Vietnam 2024 vaccine shortages, government procurement delay left children unprotected, showcasing state pharma gatekeeping that regions held like imperial siege. The procurement mechanism function as infrastructural bottleneck, quietly rationing care through administrative delay rather than overt violence. Disease modeling tightened that control. In case of osteoporosis, merge back research and advertising help strike the definition of who cow is at risk, turning a normalized stage into a market and nudging people to rely on drugs they may not actually need. Fears become architectural, built into guidelines, diagnostic thresholds, and clinical routines.
This is how lobbying works today. It's pharma's modern version of an imperial decree, not carved into stone or announced by kings, but passed quietly through parliaments, regulatory agencies, and revolving door institutions. Power doesn't shout anymore, but it blends into the system and governs from the inside. In 2024 alone, the pharmaceutical industry spent over $390 million lobbying in the US, and that money helped stall Medicare's ability to negotiate drug prices, preserving profit barriers much like imperial trade monopolies once did. And the human cost is not abstract. The opioid crisis showed that this power can produce. Purdue Pharma aggressively lobbied against tighter control while pushing Oxycontin into communities, contributing to more than 165,000 deaths in the US since 2000, echoing how empires once. This policy didn't just happen by chance. They were built in state institutions where corporate voices carry far more weight than the public's, channels of power that quietly move influence upward, much like Roman roads once funneled wealth and tribute straight back to the forum. Excavating fault lines, we find public health equitable ideals subverted by farmers' profit machinery, narrowing care to drug sales while sidelining prevention. Let's look at a few concrete examples. In 2003, the Medicare Modernization Act, shaped heavily by lobbying, blocked Medicare from negotiating drug prices, driving costs higher for patients. Then, in 2016, the Cures Act sped up drug approvals, often prioritizing speed over long-term safety. These laws aren't neutral, they're design choices that shift risks away from corporations and onto the public. But every empire has an Achilles heel. Unequal access slowly erodes trust. When patents expire, generic manufacturers move in, reusing old formulas like scavengers reclaiming fallen fortresses, exposing cracks in farmers' control. This system promises salvation through medicine, yet delivers survival unevenly based on income, geography, and power. And with that, the parallels to ancient empires become impossible for us to ignore. Rome's adequates and forum standardized provinces, organizing life under central gaze. Farmers who essential medicine lists impose global drug priorities, elevating profitable patents. Britain locked colonized via trade monopolies and railways extracting wealth outward. Pharma deploys IP and lobbying to barricade generics, mirroring opium wars forced markets. Pfizer's COVID hoarding left global south gasping. Both empires built durable infrastructures. Rome's road endured millennia. Pharma's supply chain and standards shape the crisis today. They are repurposed, but they are yet persistent.
Building on this, the lesson from Nazi Germany shows that evil doesn't always look dramatic. Sometimes it looks ordinary. The case of Adolf Eichmann shows how extreme harm can be carried out by someone who appears normal, professional, and simply doing his job. That same logic can exist in modern system. In the pharmaceutical work, the pill we take may genuinely help us, yet the system behind them can still prioritize profit over people through pricing, patents, and access restrictions. As we discussed in the Big Idea class with Professor Jason Picard, this reveals a darker side of business power. When profit comes first, ethical responsibility often fades into the background. History shows the pattern before. Companies like Coca-Cola continue operating under Nazi rule because there was money to be made. These examples remind us that harm does not always come from hatred, but from ordinary decisions made within powerful systems.
So, what does this all add up to? We haven't covered the pharmaceutical empire, one that promises health and salvation, but it actually enforces through profit, patent, policy, and fear. Now, this system is lasting because it has been built into infrastructure, but actually cracks are starting to show. As here, we can see the patents are expiring, trusts are eroding, and there are generics slipping through the walls, and these are all leading to the increasing vulnerabilities of the pharmaceutical empires.
So, whose survival does this architecture protect, and who is left waiting at its gates?
Hello, CEO Nam Pharmacy.
Come to Now Pharmacy, where you get the best medicine in the world.
So you can see that the vaccine empire, which turned out to be the pharmaceutical empire, is a marriage between what we call capitalism, which is the money, and then we have the knowledge power, which is the IP. So we have the IP and the money over here. They're gonna have a marriage, and then we have the pharmaceutical power. So when we thought of pharmacy, it's not always about the protections of human, but it's also about something very important. It's about profit. That is when we have the strip agreement, we have the vaccine nationalism, then we have the arguments around the medicines who get to get the access into it. So that is the focus of our research today. We want to say that to conclude, the importance of vaccines, or in a broader sense, the medicines, lies within who get access to it, who control it. But it's also how to benchmark and leverage the knowledge availability to everyone else. And that is the focus of us. Thank you for listening.
Pharmaceutical empire is a great empire.
We love you, Professor Jason.
For your dedication.
We love Big Idea, how empire rise and fall. Yay!
Yay!
Đọc định trước thì thấy gì?
Anh say hi đi.
Đang quay rồi đó. Thôi im lặng đi. Thôi nằm xuống đi, tao đang quay rồi đó. Vô đi, nằm đi.
Rồi.
So the vaccine serving
Thuốc giải cứu. Hấp hấp hối. Đập bụng. Hoang mang. Chạy đi tìm.